2468, stop the labor downstate. 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 2468, stop the labor downstate.
Where are people going to go? Where are people going to get health care? It's a real concern. Jobs also. There's no work. One of the things that was interesting to note was in the exit polls. When they interviewed people, the number one thing that people spoke about is jobs, that they need jobs. And at this time, what are they doing? They're laying people off.
Everybody knows there are lines out the door that people need help. And with these layoffs, it's going to be longer waits and harder to get care, not easier. And the community around here, and I'm very much in touch with the Jewish community up beginning right on the other side of this big building over here. The people know that this hospital is needed, and these services are needed, and the specialties that you guys provide so well are needed so much.
We are not going to take this layoff lying down. We are not going to take it anymore. Enough is enough. For Governor Como, Speaker Silver, and Dean Skelos, we know that in your budget, you can find the money to keep this place afloat and take care of the people of Central Brooklyn.
The time is now to save the jobs. We cannot allow the hemorrhaging of employees and staff. Nothing is worse than to realize that the employees that provided the qualitative service are being punished by the management that destroyed this hospital.
Closing hospital, closing Downstate Medical Center, closing the services, and let those people go. Layoff is not something that we can tolerate.
Now, I want to tell you that we are working, UUP, NYSET, AFT, we are working on an updated plan with our sisters and brothers and other unions that would save Downstate, that would provide and continue to provide medical education and health care in this community. We have a plan that will build health care security for all of the people of Brooklyn into the future.
I want to share with you that this does not stop here today. We have to continue to go out and tell this story to your friend, to your neighbor, go to your synagogue, to your mosque, to your church, to your school association. Let the story be known that SUNY Downstate has to stay a public hospital, has to stay a public medical school.
I see UUP, PSC, UFD here. I see PEP, I see CSEA, I see so many workers standing together. And let me tell you, from around the state, our members have been contacting legislators to tell them that this is wrong, to tell the governor that this is wrong, and we must stand together. We recognize that this institution is going in the wrong direction.
The simple message is privatization means the government has given up. They have no right. The government has an obligation to each and every employee, to each and every patient, and to tomorrow's patients. And the only way that happens if the government and the governor step up to the plate, help us get out of this problem, and keep this hospital as a viable institution in New York.
I want Downstate to restructure and help save the jobs. We can do better. We can. If we have the right management in place, we can do better, and people can keep their jobs. It's the little people that's losing their jobs.
SUNY said cut back, we said fight back. SUNY said cut back, we said fight back. SUNY said cut back, we said fight back.